First of all, we just want to thank GBS and GBMC again. I mean, we couldn't have better partners. Particular GBMC want to celebrating their 50th year this week. Fantastic. I'm from Connecticut, but I spend a lot of time here in Baltimore, and one of the things I've learned, so if you're selling to your customers, just ask them, were you born at GBMC or were your kids born at GBMC? Because that's usually a pretty nice connection, a nice loyalty, a good feeling. And so if you are, buy Habeo. I mean, that's it. Simple, right? This, that's what we're getting at, that kind of that feeling. So before I get started, I just wanted to ask everyone, just as a consumer of healthcare, when you get your new benefits, I mean, how many of us are really excited, like our new iPhone watch or whatever, happy when you get your new benefits every year? I mean, as a raise, I want you to think of it as a consumer, not as a broker or a consultant or a sales guy. I mean, they ever excite you? There's features in there that you're like, wow, it's amazing? Or is it kind of like, wow, my deductibles up a little, copays are up a little, contributions up a little, is my doctor still in? Are my kids going to be, still be able to go to the same pediatrician? I mean, is anyone just thrilled when they get them? They'll raise their hands. All right, nobody is. So what I'm going to try to show you today is that with Habeo, you will be. I mean, this is different. It is absolutely different. I've been a consumer of healthcare, I guess, for 42 years. I've been in the business for 20 years. I've worked for Oxford Health Plans, United Healthcare. I've worked for big PBMs. So I've been on the other side trying to sell stuff and make stuff that works. I have not seen anything like Habeo. And I'll show you at the end, I'm sort of living proof of that. What does Habeo do? Habeo essentially brings together the whole system in a way where everybody's on the same page. The providers, the consumers, the administrators. I mean, how often do you see a situation where hospitals and administrators are working collaboratively to provide a better product for your consumers or your members or your customers? And that's really what we've created, and we've done it through just state-of-the-art technology and sort of a great vision around changing how healthcare is delivered. So everything comes into one place, completely integrated, all the data. It just works better, and that's what it's all about. From a network perspective, I'm going to get into some of the blocking and tackling, and then Dave's going to even get a little bit further into how, because that's where we're at now. We want you to be, quoting this and selling it. But you've got a network that's focused around GBMC. Why? Because of those results. I mean, we want people to get cared for at GBMC, and you'll see that the benefits incent people to go to GBMC. But we also have, you still have to deal with the reality of healthcare. We have a network wrap, PHCS. Being in Connecticut, I access PHCS. It's fine. It works well. Honestly, I'd love to get more care at GBMC, so maybe when I'm here I can stop by. But you have complete network access, no issues. I mean, you think of that one person who's out of area or whatever, that's me. It works. It's been fine. We're essentially, and I'll explain it at the end, at HCI, we're kind of pre-Habeo. I mean, we're Habeo, everything you see in Habeo, and now next year we're going to add this connection with GBMC, and that's really going to supercharge it. But you'll see we do everything else related to Habeo, all the population health, all the wellness, all the incentive benefits. So we're kind of living and breathing it right now, and hopefully I'll explain to you at the end that it really works. GBMC, you heard a lot about this. I mean, one of the things when I joke, I mean, we started this conversation the week after Thanksgiving. And to be here now in healthcare world and hospital world is speed of light. I mean, things don't happen that fast. Where people are busy, they're changing their EMRs, they're doing capital improvements. When we went to GBMC and saw the PCP office, the patient-centered medical home, and how it works and how when you say it's invested a lot of money, I think from the outside you kind of go, oh, it's a PCP, what can you do? They've done a ton. They've changed the format of the office. You walk in, you get directed right into a room. There's a workflow behind the room. It just works better. And they have all the information they need. And with our technology, now we're supercharging them with benefit information, claims information, pharmacy information. Ultimately, that physician's going to know, wow, this individual has an incentive to lose weight. Let me talk to them about that. I know they're going to get 50 points if they do that, and 50 points mean they're going to pay less. So now I got a patient who is engaged, and I have the information there to help them do that. I mean, it's just a different model than, waiting in the office and, redoing all the tests because the information isn't available. So we were just blown away by the work and the results that they've had, and we feel like, just very excited about the partnership. What do you get, this patient-centered approach? Essentially, this is sort of the, I guess when you look at the new iPhone or the watch, what are the bells and whistles, right? What are the things that get you excited about healthcare? These guys are doing most of the work, taking care of you when you're sick or, ongoing, obviously, dealing with sort of chronic conditions. But what else do you get? You get a health coach who has all the data and information in front of them to help you, change your behavior and improve some of the things that we know are causing these cost increases. What else do you get? You get data that comes together that can predict costs. With our technology at HCI, now everyone's going to be totally armed with who's medium risk moving into high risk. What information do you need to take care of that person differently? And ultimately, online resources and essentially wellness resources come completely embedded in this solution. So it's not disparate. It's not sort of this, one-day clinic that's not connected. It's completely integrated into the solution. We sell wellness and population health at HCI across the country to very big employers. And when we do, we kind of sit down and we go through what their needs are and what their culture is and where they are in their sort of wellness and their population health strategy. We're trying to make this simple. You'll see you can sort of pick and choose different options. So you can choose sort of the lifestyle challenges, kind of the Biggest Loser or walk 10,000 steps, those challenges. You got the digital coaching modules. We have sort of the online education seminars and then on site. So these will be sort of embedded in just sort of wellness. I want wellness plan A, B, C. So it's not too complicated. So people will be able to easily say, and it'll be easily deployed. But we deploy these across the country to very big customers all the time, and they really are integrated into the solution and back up what we're trying to do. As you can see, everybody at HCI, we all have our Fitbit on. The data is completely integrated, so this is where it gets kind of cool, right? You sort of say, wow, my health plan, I have a Fitbit that's integrated into my benefits. It knows how much I'm walking. Wow, my doctor knows that I'm active. And it's just really sort of brings everything together. I mean, in some regards, if you're not talking about mobile health today, and because it's just the tipping point. One of the things I like to think about with Habeo is this is where we're starting, but this is not where we're finishing. I mean, with this collaboration, we're going to sit down and say, hey, what about this? What are you guys thinking about that? I mean, you talk to companies like Under Armour who are putting things in shirts to detect your, information about you, and their information is going to be available for, imagine the physician being able to know, okay, well, there's a change because this person's, I was able to see it through this technology. I mean, it's just exploding. So if you don't have a health plan that's integrated with mobile health, I think that's a big gap. And, if United gives away a Fitbit and says you get a lower premium, even though they just increased their premium to sort of, that's not what we're talking about here. We're talking about data that's integrated, useful, and helps you improve your health. We will have not only your claims information, your pharmacy information, your screening information, your health risk assessment, your EMR will be in one place for everybody to look at. We all work in healthcare to some extent. We all know that that's not how it operates today. And that is a complete game changer. So if somebody isn't taking their diabetes meds, we'll know. Either the physician or the care manager at GBMC will interact, or a coach will interact, and we'll get that person back compliant so they don't show up in the ER. Predicting costs, we use the Johns Hopkins modeler. Fantastic. It gives us a real good sense of what's not just happening today, but what's going to happen in the future. I mean, that's huge, right? And then the health risk assessment and the screening starts to tell us more about not only, what's going on with that individual and their own sort of clinical makeup, but also where are they at in terms of their readiness to change. When they fill out our health risk assessment, we get a real good sense of how they're feeling about their health, their sort of willingness to make certain changes, and that factors into how our coaches interact with them. All right, so benefit designs. Essentially, the benefit designs, there's a couple of variables here, right? I mean, we obviously wanted to sort of match up. This is sort of where all that stuff is the cool stuff. The partnership with the physicians is the cool stuff, but you still need a way for, customers to engage and buy healthcare, right? And this is sort of the, we've tried to make it smart and make sense, but essentially you've got kind of a PPO, sort of heavy and light, sort of more benefits and sort of medium benefits. This one will probably match up with sort of a kind of a Care First PPO kind of product. We tried to mirror that to some extent. You've got selection around whether you want the PCMH or not. And generally, if you select the PCMH, which we saw from John's slides, you want to, because you're going to get a better result. We want you to, no co-pays. There's a lot of incentives to select the PCMH, but you don't have to necessarily. And then we have sort of the EPO structure where you go even further and not offer any out-of-network benefits. And then on this side, you kind of have the same mirror where you have the high deductible health plan, kind of the heavier benefits, the lighter benefits, PCMH, yes or no, out-of-network, yes or no. So if you kind of put that in a matrix, you kind of have 16 choices. I think it'll be pretty clear and for you guys to understand that, okay, this one sort of, this matches up well with this customer's current benefits, and hey, do you want PCMH or not? Here are the benefits, yes or no, is a big sort of, obviously we want you to say yes. We think it's going to be a better outcome, a better price point when we go to the underwriter, but that's, this is sort of the process, and I think you'll be very familiar with these and when you're interacting with your clients. So I think we did a nice job here of trying to give all the options. And then as I mentioned before, we really tried to simplify. I mean, you can't imagine if we're dealing with a employer who has 20,000 lives and they want to 10 different options around how to incent employees or what have you. It can get complicated. So we try to really simplify it on your wellness, 4 or 5 different options, and you can kind of, once you click on it during the process, we'll know what you need. We'll deploy it simply. We'll try to make it easy so HR doesn't, we're always trying to make sure HR doesn't have more work to do, right? That's really important. So I think we've done a nice job of taking what we know works, but making it easy to use on the wellness side. So what do you get? You get a great PCP network. Phenomenal. We couldn't be happier working with these guys. We've got very strong data that predicts costs, incentives to drive people to improve their health, and collaboration with their physician. That's really what matters. Real-time actionable data, a portal that's not only on your phone but on your computer as well, that keeps you informed, your deductible, where you are on your challenges, where your incentives are. It's all right there, easy to use, no hurdles, engaging wellness activities and communication, and all the plans that you need. So we started sort of Habeo without the PCMH January 1st, right? So when I started basically my coaching, all my information in one place, goals, incentives around how much I paid for my health care, I was 35 pounds heavier, on blood pressure medication, and just kind of moving along like everyone else, not really taking care of my health. I'm in the healthcare space. I wasn't really paying attention to anything. On the road, I'm eating poorly. I'm not really. So with Habeo, I feel great. I'm engaged. I'm a better employee. I'm more enthusiastic about my health benefits. I'm off my blood pressure medication. I feel great. And that's without the supercharge of the PCMH. Imagine if you had that, where the PCMH is like cheerleading you on, and hey, that's great, Mike, you're doing this. How you doing with how much you're contributing to your premium? So it works, and we really are excited about you guys starting to present this to your employees and bringing us quotes, and we'll back it up with better rates, and we couldn't be happier.